Good morning, everybody. My name is Dr. Emery Pitcel. I am the owner and chiropractor at Rothrock Chiropractic and Rehabilitation here in State College, Pennsylvania. This is the presentation that I did December 3rd, the year of our Lord 2024, and it was for my BNI chapter and group. So what I wanted to do was actually take a moment to record it and present it for everybody to watch. So thank you for tuning in to this presentation. So what we're going to go over today is a concept that's called a wellness web, which is actually tying in how our practice ties into the greater community of State College and Central Pennsylvania at large. So the first thing we have to do is we have to go over a little bit about us briefly. So we are located in State College, Pennsylvania, and we are a chiropractic office that is predicated on physical rehab, especially the McKenzie method of physical therapy, and we progress exercises along with our treatment plans to really self-empower patients and allow them to get themselves better. Now, we marry that together with a lot of muscle therapy, soft tissue work, and stretching, and also mix that in with chiropractic adjustments to maximize people's therapeutic healing. My mantra in our practice is that we are a no rush office. We spend lots of time doing high quality technique and therapy for patients, but that also gives us tons of opportunity to actually listen to patients and hear what they're saying their other needs are in the community. Because while I might be great at pain management and restoring people's function, I'm not an expert when it comes to other health and beauty and wellness areas. And that's where this presentation's purpose is to step back and take a 30,000-foot view of State College and Central Pennsylvania at large and realize that we don't have to be the best at everything. Instead, if we recognize that looking through the world of a lens of abundance and opportunity, we can refer and recommend other providers and business owners for our patients when we feel like they have needs that we can't fulfill. And that has really two major benefits. Number one, it's going to allow us to help other businesses and other practices and other health, beauty, and wellness uh, businesses grow in the area. And for those that are members of BNI, they know that that's the BNI's giver's gain mentality, or it's actually predicated on through the law of reciprocity, passing high quality referrals to other business owners so that way they can grow their businesses. And in turn, it can hopefully pay back to us and help us grow too. But the second part that's really huge too is this approach also helps patients and clients with the other pillars of their health and wellness beyond what we could provide at our office. And that actually allows us to treat patients holistically, and it humanizes them because then we're actually listening to what their concerns and their needs are and trying to plug them with providers that can really help. So this all ties us into the wellness web at large. So what is the wellness web exactly? We need to first define what I believe are the four major pillars of health and wellness in general. And first, there's the neuromusculoskeletal and physical health. That's where, as a chiropractor, we plug in. Next, there's also mental and emotional. There's gut and internal health. And lastly, skin, external, and beauty health. And all four of these pillars are critical for our overall health and well-being, and they actually are all very tightly intertwined. Now, I'm not going to go super in depth with this, but I want to go over at least a little bit how each of these ties in and connects to each other and how it quickly creates a web. So on the physical health side of things and mental health, those are two that are very well connected. Let me give an example. Have you ever had such bad low back pain that you start to feel like you aren't mentally able to think the way that you can? It starts to mess with your thought process and become grumpy and angry with people around you. Well, that is somatopsychic health connection. And that's a real thing where people get in pain and therefore it messes with their brain chemistry and how they're able to think. But the door swings the other way too. We also know that if people are struggling with, say, depression, anxiety, that it has a way of dropping down that pain threshold and making it more likely that they will perceive pain, and people with depression, anxiety actually feel more physical pain than people that don't. So that's the first connection. Our second one that we want to highlight is that the physical health does actually tie into internal health. Again, using the example of low back pain, has anyone ever had such bad low back pain that they start to feel super nauseous and sick to their stomach and just not well on the inside? And once again, if we're in a lot of physical pain, that's actually going to put us in a fight or flight sympathetic response and turn on internal inflammatory markers to actually make us feel sick on the inside. But once again, things go back the other direction as well too, because if we are dealing with a gut that isn't absorbing macronutrients and micronutrients as well as it can, then we're not getting the nutrition to create the building blocks and proteins to heal up our body, and we stay locked in physical pain. Now, the last one here, maybe not as intuitive, but I argue that physical health is tied in directly with skin and external. And here's how. If you are in a lot of physical pain, then you're not really able to take care of your external environment or take care of your self-hygiene as well as you should. So therefore, as a direct result, that takes a direct hit and impact on your skin, external, and beauty. But also, once again, it swings back the other way because when people really are taking care of their skin, their external beauty, as well as they possibly can, I believe that gives them that self-confidence. It keeps that pain threshold line that we talked about earlier, keeps that up as high as possible to keep people out of unnecessary physical pain and aches. But it's also important, that's how the neuromusculoskeletal and physical connects to the other three. But real briefly, the other ones have connections as well too. There's a lot more studies and research going into the gut-brain barrier now more than ever, and that understanding that what you eat does directly impact your brain chemistry. For example, there, I know whenever I go out to eat fast food, I sometimes get like a mental fog and don't feel like I can think as clearly as I can. I'm sure some of you feel the same way as well too. Now, the internal health and gut also connects directly to skin because a similar personal note, again, eating a lot of fast food, that sometimes makes my skin oily and I start to break out with acne. I'm sure I'm not the only one that has that happen too. And we kind of already alluded to skin and external connecting to mental health. People that are the happiest with their outward appearance and the way they dress and the way they feel are going to have more mental confidence. And that also kind of swings back the other way, where if you have that good mental confidence, it's going to help you want to express your outward beauty the best. So that's inner beauty. It gets expressed as outward beauty, and outward beauty gets expressed as inner beauty. They really do connect in together. So then when we start to connect all these webs and kind of draw it all together, we see that everything becomes a very tight inner mesh. And all these four pillars of health are actually very directly tied and linked together. But what is this red circle that's in the middle, and it's been in the middle this whole time, that has three question marks, right? Well, what that is there's one thing that exists that could kind of gum up the works and have a direct impact on all four of these pillars. And that one thing, if you want to take maybe a moment to try to guess or speculate what it is, you may. I'll give you a few more seconds to maybe think of what that could be, but it's stress. Now, stress is what really starts to directly impact all these systems and all these pillars. And our goal as healthcare providers, as wellness providers in this area, is to keep the stress circle centered. As kind of a little bit of an analogy to go back to the low back pain, if somebody's struggling with a lot of low back pain, what that's going to do is pull the stress over to this side of the pillar. And you can see how that through the graphic kind of puts unnecessary stress and strain on all the other web connections that connect gut internal, mental, emotional, and skin external and beauty, right? So our goal is to keep the stress in the center of the circle because that's when people are at their most holistic wellness. So in order to fully understand this, we actually have to define what exactly is stress. Because in a lot of people's minds, they say stress is anxiety. And while anxiety is a type of stress, it's not exactly the all-encompassing. Instead, I want us to think of stress as micro traumas plus macro traumas. What the heck does that mean? So here's what it means. Micro traumas and macro traumas are these. I'm going to list seven of them. How about poor in diminished or decreased sleep? Insufficient diet or a poor diet. Somebody that's struggling with self-esteem and self-worth and self-vision, that's where anxiety plugs into this picture. How about a breakdown in family, community, and work networks and relationships? That's definitely going to create stress. A diminish in hygiene, whether that's self and internal or the external and environmental hygiene around you. People that are exposed to unnecessary toxins or are struggling with substances or drugs, or even those that are maybe on more medications than they desire to be, could create stress. And last, diminish in exercise, which then harms activities of daily living. It takes a hit to people's hobbies. All of these are going to be micro and macro traumas that are going to feed into stress and start to pull the stress out of the center and start to mess with the beautiful connection of the wellness web. So here's my first referral ask to the general public here. And it's that there are 7 points that I listed as micros and macros. I'm not an expert at each of them, but let me highlight things you should be listening to that suggest it's probably a good idea to have a conversation with us at Rothrock Chiropractic and Rehabilitation. The first is somebody that mentions I can't exercise and move the way that I used to. I'm not able to do the activities that I used to do in a day. I can't clean the house as well. I used to love doing this and now I can't. And ask that next question, is it because of physical pain? Because if it is, that's a stress barrier that we can remove at our office through exercises and adjustments. If you know someone really well and they tell you that I'm taking a lot more ibuprofen and Aleve lately to cut my pain, or maybe you know them extremely well and recognize that they're maybe self-medicating with alcohol, and if pain is the reason why they're doing that, send them our way so we can get them out of pain. And last, every once in a while, someone says, "Oh, I slept horrible last night." And if that's because of a physical ailment and pain, recommend them over to us so we can get them on exercises and adjustments to start getting them better. That's just three quick highlights on ours, but the reality is we need the full wellness network to actually get every single facet of these stress causers in check. Because the reality is, if stress goes unchecked, then we get aware and lack of repair, aware of and damage at the cellular level, and then the body is unable to heal itself because of the stressors still being present. Notice what I didn't say. I did not say wear and tear. The reason why I didn't is because wear and tear implies that the body breaks down and then it doesn't have the ability to heal itself. Wear and lack of repair is a lot more encompassing because that's actually what happens in all of us. Our body is going to wear and break down no matter what. But the more of these micro and macro traumas we push out of the way, the better our repair and healing is. Our bodies are amazing, beautiful, strong organisms that are capable of self-healing if we set up the environment for it to happen. And that's what takes us back to our wellness web, because I acknowledge the things that I'm good at as a healthcare provider, but I can't cover all of those stressors by myself. I'm really good up here at the neuromusculoskeletal and physical, but we need more help and more people to connect and more providers to be in our network to allow us to more holistically treat more people. And so that's my referral ask number two is whether it's a strong connection to those providers or let's get them into our BNI chapter or another BNI chapter so we can really foster that deep relationship. So in the neuromusculoskeletal, I'm already the chiropractor in our chapter up there, but we're looking for connections to massage therapists and physical therapists, personal trainers, and acupuncture to make that pillar as strong as possible for people. In the skin, external, and beauty, eye care providers, skincare, someone who sells fine jewelry and clothing and accessories, and a hairstylist. For gut and internal medicine, a connection to dentists, those that sell supplements, alternative wellness centers, nutritionists, and functional medicine providers to bump up that side of the health pillar for people. And mental emotional, also equally important. We would love more connections with talk therapists, wellness coaches, and life coaches. And because the reality is this, I've got a big grand goal, and it's this. I want people to be the healthiest that they can. I want people to be healthier. And the more we have the ability to plug and refer and recommend them to people that are better at covering the other facets of stress, the better off we are. And so I also charge us that I'd love for this BNI chapter, really this BNI region, Central Pennsylvania, to be the healthiest BNI region in the entire United States. And how do we accomplish that? By making the wellness web full. And if we accomplish those two things, that we are going to have the healthiest possible state college in Central Pennsylvania that we can. Now, is this a little bit of a lofty goal? Of course it is, but it can be achieved. And the way it can be achieved is by filling the wellness web. So let's fill the wellness web with lots of high connections so that way we can make a lot of referrals and recommendations and make our community as healthy as well as beautiful as we possibly can. So I have one more referral ask for those who are, watching the video. And if you made it to the end, thank you so much. But the referral ask is this is on YouTube, it's on Facebook, it's on Instagram. Please, please share this with somebody that you believe can benefit from hearing this message. And if there's somebody that you know that is of this mindset that they want to network through abundance and opportunity and referral based and relationship based connection to improve patients overall, then let's have a conversation. Let's have a connection. Share this video with them, please. And thank you. I appreciate everyone for their time for watching the video. And once again, from Rothrock Chiropractic and Rehabilitation and the BNI Virtually North Central PA chapter, I am Dr. Emery Pitcel. Thank you so much, everybody. Have a great day.